Hi guys, so this video is going to cover ADHD, and it's just going to be a very brief description of what it is. And what I wanted y'all to know basically is that the diagnosis has changed. It used to be separated by two diagnoses, ADD and ADHD, one of them being the inattentive and the other one being the hyperactive. So I wanted to kind of discuss that and what that means, and as a parent and educator, it can mean different things to you. But first of all, what is ADHD? So it's when a child, an individual, cannot focus. They're inattentive. Their mind tends to wander. They can't deal with multitasking. They have issues with being able to do more than 2 or 3 step directions a lot of times because they lose their way. People with ADHD tend to have issues with organization. They can't organize things in their mind, so can you imagine organizing things in their daily life? So that is a kind of a brief overview of what ADHD is, what it looks like. So depending on the type, you might have someone individual who cannot focus for very long to a conversation. Their mind will wander. If you're a teacher, you will see that a child will daydream a lot, or maybe they are focused on something else instead of what they're supposed to focus on. As a parent, you might see it as a child who cannot get through their homework because it's, you know, their attention span is so short. Now let me express something or explain something to you. Attention spans, there is a normal attention span depending on your age. So we're talking about attention spans that are abnormally lower than what they should be. Obviously you can't expect a 2 or 3-year-old to sit down for longer than 5 minutes unless they have something to do. So you would never put a 2 or 3-year-old in a 5-minute timeout, for example. At least you shouldn't. Anyway, so what I'm saying is that it's actually their attention span is shortened for their age, for what you would expect at that age group. Now, another thing I want to mention is that people with attention deficit tend to be creative, tend to be, individuals with a lot of different interests. And so sometimes you will see adults who pursue different career paths, for example, and, they just cannot stay with one job. And so that's one of the things that you might see later on as, an individual gets older. As a child, they have issues with schoolwork. They have issues socially as well. It can get on your nerves, on anyone's nerves, when you're talking to someone and then they're like, huh, what? Like they weren't really listening to you. They get distracted or they change the topic, kind of like I do. So you go from one topic to the other, and it's hard to follow someone when they are changing the topic every few seconds, isn't it? I can do it. So anyway, so those are some of the just blanket kind of descriptions of ADHD. Now, how is it diagnosed? Again, you have to go to a psychiatrist, psychologist, and then you'll get a questionnaire that you'll answer. If you have a spouse, your spouse will answer. The teacher will answer. If there's a teacher, preschool teacher, whatever. And then they will take all that data, and then they will get back with you and tell you whether or not your child has attention deficit. Unfortunately, there is not a blood test for it. Just like autism, there's not a blood test for that either. It's based on observations and behavior patterns and things like that. So some might say that, it's a little bit arbitrary. Is there an overdiagnosis of ADHD? That is a legit concern. In my opinion, I don't think there is. I just think that there is a lot more cases of it because we have better ways of diagnosing it, and parents are at their wits' end trying to figure out what to do with their child, or the teachers are at their wits' end trying to figure out what to do with these children. And so Therefore, you end up with more, diagnoses of ADHD. So ADHD is a complicated diagnosis because once you get it, you're like, okay, now what? So these are kids, that are either inattentive or they have hyperactivity. And then the doctor says, okay, let's prescribe them a amphetamine, an upper, a high, a pill that'll make them high and active, right? It's the weirdest thing. For some reason, these medicines will calm a person with ADHD down. And it's kind of interesting because their brain is going woo, 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 woo. And I guess the medicine somehow is able to help them focus, help them to, to harness all that energy and that and what's going on in their brain. It's amazing. It really does work for some children. So you may want to give it a chance, and it could be something short term. With my children, I give it to them during the school year, or if we have church or something where they have to, settle down and concentrate. The rest of the time, they don't need it. But then you may have other children that are so hyperactive that they need medicine in order to do every ordinary things just to function. And when I see that, it's kind of pretty impressive to see that result come out of a little pill. And of course, they have different ones now. They have Focalin, they have Ritalin, Adderall. They have all these different types of medication for your children. Strattera, just, it's a matter of your preference, what you're comfortable with and what works really. There's no magic bullet. What works for one kid may not work for the other. And so there you go. Now, I want to keep these videos short. And so to close off this video, I just wanted to say that with ADHD kids, there's a lot of impatience on the part of adults and teachers and all that. I would ask you if you could show a little patience to these kids and try to figure out ways to deal with the fidgeting and all the things that you see exhibit with children with ADHD. They can't stay still. They have to, I have got fidget cubes. I got things that my students can use in their hands and kind of distract them. I've used essential oils like lavender to help calm them down, and that seems to help. And so there are many tools out there now, age-appropriate tools that you can give a child so that they can harness, just release some of that energy that they have built up inside of themselves. And so I just wanted to kind of throw that out there for you. You can Google the fidget cube. They come in all kinds of sizes and shapes, and different companies make them. So you can get them as cheap as $2 or $3 all the way up to about, almost $10, depending on the complexity of them. So I hope that this video provides a little extra insight into ADHD. And also another thing is that I mentioned this earlier, ADHD does exhibit differently in girls. So one of the things that you might want to look into is research the symptoms, boys versus girls, because it'll shock you. It's really amazing the difference between girls and boys, their ADHD symptoms. So the girls tend to have more of the inattentiveness, and it does affect their social, skills, and it does affect the way that they interact with others. And so I would encourage you to check on that. In the next video, I would like to talk about some of the challenges that parents face with exceptionalities. So I'm not going to focus as much on ADHD and autism but I will talk about exceptionalities and what we can do to provide that village that most parents are seeking to get through this phase, especially the young age. That's the hardest part. So thank you for listening, and I will see y'all very soon, and y'all take care. Bye-bye.